I came across a paper recently. Honestly, it was kind of mind-blowing, not because it introduces brand new technology, but because it combines technologies we already use in a way most of us never really thought of to apply. It uses 4D style simulation to look at full arch cases from a completely different angle. Can we predict facial soft tissue support before we commit to a prosthetic plan? Not after surgery, not after delivery, before. And instead of answering that with experience alone, this paper asks whether we can do it digitally. This is a 2025 Journal of Dentistry proof of concept by Dr. Mia Perk and Dr. Thomas Jada, with simulation development from Align Technology. And they're very clear, this is about feasibility, not validation. If you do all on X, you already know this. You can do everything right technically and still miss the case because lip support was wrong. The paper actually states that loss of lip support can determine whether a fixed implant restoration is even feasible. So here's what they do. They build a virtual patient by combining intraoral scans, lab scans of the prosthesis, and 3D facial scans aligned into one coordinate system. Then they simulate how facial soft tissue, especially the lips, physically adapts to the prosthesis. This is not a photo overlay or smile filter. Soft tissue is modeled biomechanically using neo-Hookean elastic material model with standard parameters. Contact between tissue and prosthesis is computed using smooth sliding collision algorithms, and the simulation runs iteratively until equilibrium. What they show is that this workflow is clinically feasible, alignment is accurate, and patients can preview outcomes before treatment even starts. Now here's where my thinking expands beyond the paper. Once you can simulate soft tissue this way, you're not limited to just lip support. You can start asking bigger questions, like how vertical dimension changes affect facial strain, or how different prosthetic volumes change tissue loading. You could eventually explore lateral or protrusive movements or occlusion-related deformation, not because this paper proves it, but because biomechanical framework now exists. In All-on-X specifically, this could help visualize how bone reduction, emergence profile, and prosthetic volume interact with the face. Not perfectly, but earlier. It also highlights limitations we can't ignore, which is tissue firmness varies with age, alignment accuracy matters, and the current workflow relies on proprietary simulation software. So this isn't a finished clinical solution yet, but it's a breakthrough in thinking because it connects scanning, biomechanics, and simulation into a framework that lets us ask better questions earlier.